Hi there, I'm Nadia Fantastico, one of the personal trainers at John Paul's. This video is for the postnatal clients, and it says discuss the diastasis rectus abdominis, which is your abdominal split, which happens, it's very common, it happens through your pregnancy. So your abs will split right down the middle and there'll be a gap. So I'm going to demonstrate how to check if you have that. If you find that difficult to do on your own, once we're able to, after the lockdown is eased and we're able to, I'm quite happy to assess that for you. So you can call me on 07 870 684341. Okay, so how do we check it? We'll get down to the floor or on a bed. Okay. Safe way to come down is sit, come onto your side. Okay, very important to use this technique after you've given birth, just in case you have that gap. And then roll back. You want to avoid crunching up and sitting up, because that will make that gap bigger. So, okay, so it's onto the side to get up and onto the side to come down. Okay, so you'll be in this position here. You're using 2 fingers, and you'll put your fingers at your belly button. And you'll press. And then you'll curl up slightly. And what you're looking for, if you just look down at your fingers, to see if your fingers fall in between your abs. And then you'll move your fingers up and down the middle of your abs to see if your fingers are sinking in, and to see how wide that gap is, if it's 2 fingers or 1 finger gap width, or even wider than that. So you're pressing, you're curling, you're looking down, and you're working your fingers all the way up to the top of your abdominals and back down again, all the way down to bikini line. Feeling if you've got a gap and how wide that gap is. If you're struggling to use that technique, another way to know if your abs have split, if you go to curl up again and your abs are in a dome shape, they bulge out like this, like I'm showing you with my hands, that will tell you have a gap. Okay? So as you come up, there'll be a bulge, there'll be a dome here. If I give your stomach a funny shape, right? Your tummy. And back down again. Okay, so the exercises you must avoid at the start, if you've given birth, are planks, crunches, twists and sit-ups. Okay, you'll be able to do them once your deep muscle groups have been activated, they're working and that gap is closed. But to begin with, you must avoid them, because all you're going to do is cause more stress and that gap will get bigger and it'll take longer to recover and heal. So I'm going to show you the baseline exercises you should use that are safe and effective from the start. Okay? First one. Lying down. And what you're going to do is put your fingers down at your pelvis. I'll show you, I'll turn to the side and show you. Down low. And you're going to pull your tummy muscles in as if you're drawing in your tummy muscles to close a pair of tight trousers. Okay? So pulling in. And relaxing. And drawing your muscles in towards your spine. I'm going to pull up my top so you can see better. And relaxing. Now you want to hold that up to 10 seconds. And you want to do about, say, at least 10 repetitions, okay? Ready? So pulling in again. Holding. And relaxing. And again, pulling in. Now you're trying to pull in the muscles, but not hold in the breath the whole 10 seconds. You're trying to contract just the muscles, but you should be able to still talk. You might find that difficult to begin with, but that's something you could work towards, okay? And relax. And relax. So like I say, maybe just now you'll have to hold in your breath to keep the abs in. That's quite common. You ready? So pull in. So, So, I'm pulling in my muscles. And relaxing. And again, pulling in. Now you're trying to pull in the muscles, but not hold in the breath the whole 10 seconds. You're trying to contract just the muscles, but you should be able to still talk. You might find that difficult to begin with, but that's something you could work towards, okay? And relax. And relax. So like I say, maybe just now you'll have to hold in your breath to keep the abs in. That's quite common. You ready? So pull in. Breathing normal, but I'm keeping the muscles pulled in. And then relax. Halfway. Pulling in again. And relax. It's good, quite good to keep your hands down or your fingers down to this lower level here, down the bottom at your hips, your pelvis, so you can feel your abs going in, okay? Ready? And again, draw in those muscle groups. Try to avoid holding in the breath. I know that's hard. And relax. A few more to go. Ready? Pull in. And relax. Pull it in. Lovely, and relax. One more, ready? Pulling in. Feel the muscles going in with your fingers. Holding up to 10 seconds. 10 seconds is too much to begin with, that's fine. And relax. Okay. Next exercise that helps close your abdominal gap, that are safe and effective. Feet up, 90-degree bend at the legs. You're going to take one foot down, one heel down, and then take it back up again. But as you're doing that, try not to arch your back and push out your tummy muscles. Keep your pelvis tilted towards you. Okay, that's your pelvis tilted towards you, so your lower back stays flat against the floor as best you can. If taking the foot all the way down to the ground is too much, just take it halfway and then back up again. So what we want to avoid is this happening, your back arching and you're pushing out your tummy muscles. Okay, so 90-degree bend. I either go halfway down and then back up again, or all the way down and back up again. Let's go 10 either side if you can. Stop if it gets too many reps for you. Inhale, exhale. Inhale, pushing it back down onto the floor. As you exhale, feel your abs go in. Remember this halfway option as well. It's harder than it looks. Try to keep that back onto the floor. If you're really struggling and you're losing your form, the back's arching, that means you're just doing too many reps, okay? Just stop. You can always build up to the 10 repetitions on either side, okay? Lovely. Okay, next one. Feet a bit hip width apart. What you're going to do is going to slide one foot out, slide the heel along the floor, and then draw back in again. So I should have pulled down my top because you still need to focus on that lower back getting pushed down using your deep muscles and your abs, okay? So push that, just stretch that leg out, Avoid that back from arching, pushing out your tummy muscles, and then draw back in again, keeping that pelvis tilted towards you, this way. Stretch the other leg out, and then draw back in. Again, you're working up to 10 reps either side. It's always good to keep your hands near your torso so you can feel if you're pushing out your tummy muscles, if you can feel that you're pulling that back away from the floor, okay? Also helps you focus on keeping that pelvis tilted towards you if you use your hands down in that area as you're doing the exercise, okay? Now you can go slower than me, okay? If you need to draw the leg in a bit slower so that back stays down on the ground, and do so. Don't worry if there's a tiny bit of lift in here, okay? We're just talking about if it arches too much off the floor. Couple more either side. And relax. Okay, get some water if you need to, and I'll demonstrate the next exercise. Your legs are going to be up again at 90 degrees. I'm going to keep the right leg where it is. I'm going to just drop the left leg down to one side, and then take it back into the middle. But don't let that right leg move, okay? So we're now going to change. The left leg will stay where it is. Right leg moves out to the side, keeping the left leg fixed, and then taking the right leg back up to meet. Again, up to 10 reps either side. Breathe out when the feet come back up. My leg comes up, as you say. Inhale to lower, exhale to lift back in. Almost there. Couple more either side. Last one. And relax. Okay, and then one more. Just going to get a wee drink of water. Okay, pelvic tilt. Okay, so you're actually going to arch your back purposely this time. Okay, push it back away from the floor. Tilt the pelvis away from you. That's been pushing it away from you. Okay, and then you're going to pull it back round towards you as you're pushing your back down onto the floor. Okay, so watch it first before you join in. And then relax that away. Okay, so we're going to do 10 repetitions. Okay, so back off the floor, pelvis tilted away, get ready to pull it towards you and push it back on the floor. Exhale at that point, a little pause, and then relax and pull that away from you. And again, draw round the pelvis, back flat, tummy in deep towards the spine as you're pushing it back down onto the floor. Pause, 5 to 10 seconds, and then relax and pull that pelvis away from you. And again, pull the pelvis towards you. Away, towards you. Away. Inhale, exhale, towards you. Inhale, away. Inhale, exhale, towards you. This is halfway. And away. And again. Inhale, exhale. Five to 10 seconds, hold, away, and then towards you to hold as long as you can, up to 10 seconds. Three more. Inhale, exhale. Inhale, exhale. Last one. Inhale, exhale. And relax. And that's all the exercises for this video. There will be a postnatal workout exercise video that will follow on the Members Hub, and I look forward to doing that. Bye just now.